This is the medical reel approach to the discussion of radiographs. First, name the radiograph. Which part of the body does it show? Next, describe the adequacy of the film. For example, is it well penetrated? And does it show you the areas of anatomy that you know you need to see? Next, one can go about making a systematic description. For example, with a chest radiograph, you may wish to first describe the airways, such as the trachea and the lungs, and then move on to the cardiac shadow and the costophrenic angles, and then any other tissues. However, an alternative is to describe right away the most striking abnormality. This is risky as it commits you to things early on in your observation and description. However, some examiners prefer you to do this in order for you to get through a number of radiographs quite quickly. Lastly, collect your thoughts and make a summary with some conclusions, and this may include a differential diagnosis for what you've described. A handy acronym for this approach is RAS, the radiograph, its adequacy, a systematic approach, or the most striking abnormality, and finally a summary, including conclusions and differential diagnoses. Let's see this approach in action with a chest radiograph. This is a plain chest radiograph. It is a PA film. I know this because AP films are normally noted. The left side of the patient is clearly marked. The film is adequate. I say this because all areas of the chest that I wish to see are clearly visible, including the apices of the lungs and the costophrenic angles on both sides. The vertebral spinous processes are clearly visible behind the mediastinum, suggesting that the radiograph is well penetrated. The patient has made a good inspiratory effort, as more than 6 ribs can be seen anteriorly. The medial heads of each clavicle are approximately equidistant from the spinous process of the vertebra here. Thus the patient is well positioned and not rotated. Now, having been sure of the adequacy of the film, let's discuss a systematic approach. Firstly, I start with the airway, or the trachea. The trachea is clearly visible and is central. It is not deviated. Just distally here we can start to see the right main bronchus and the left main bronchus. Moving on to the lungs, one can clearly see lung markings right up to the edge of the chest wall on both sides throughout all regions. And there are no obvious opacifications within the lungs themselves. Looking at the heart shadow is clearly visible throughout all regions. The heart is not enlarged, as the cardiothoracic ratio is less than 50%. I can clearly see the cardiophrenic angle and border here, and the costophrenic angles on both sides. The costophrenic angles are clearly visible and are sharp. There are no obvious soft tissue abnormalities, and I see no obvious bony abnormalities either. Now, one could report striking abnormalities. However, in this radiograph, I see no striking abnormalities. This leads me nicely to a summary and conclusion. In summary, this is a plain chest radiograph, a PA film of an anonymised patient. There are no striking abnormalities, and this would be consistent with a normal chest radiograph of a healthy patient.